Hello.
Hello, how are you?
Well, I'm good, but you may have a small problem because the email you sent us this morning or at 11:30 has two Zoom links. One does not work, one does work.
Oh,
So
no,
the 9006 does not work, but the 7813 did work.
the 7813 does work. Okay, so let me see if I can resend that right now. 7813.
Yeah, I tried the first one, the 9006, and it said invalid. So then
Okay,
I popped on the second one, and the second one worked just fine.
all right. Thank you for that heads up.
Oh,
Thank you
no
for
worries.
trying both of them, and I'm gonna send that out now. Um,
No worries.
the right Zoom link.
I hope that's the right one I used. I think it was.
Okay.
Let me try the 9006 one more time. Yep, that's the one that's wrong.
Okay, so I'm sending out the 7813 is the one I'm sending as the right one.
Correct. Yep,
It's
I just tried the 9006 and it came back. Bloop, wrong one.
Oh gosh. I am up in Darrington right now.
You like that Darrington?
It's just beautiful up here, right? Well, so I'm doing some of the same kind of work, but over on this side of the water.
Oh,
And yeah, the mountains are just gorgeous here.
I spent a lot of time up in New Halem.
New Halem. Okay, so which
You're
direction is
there.
that from here?
You're almost there. If you're in Darrington, New
Really?
Halem's up, yeah, Highway 2, just before you get to Stevens Pass. New Halem's where they shut the road down for the
Oh,
snow. So that's above concrete.
uh-huh. Oh,
Yeah, I
yes.
spent
Okay, so I know where concrete is.
Okay, so keep going
Okay.
a little further north, and it's a town called New Halem. The town is owned by Seattle Public Light. The people
Oh,
that live in the town are Seattle Public Light employees. The only people that live in the town are Seattle Public Light employees. We were fighting the sourdough fire, which is up in the park, up
uh-huh.
behind it. So
Oh my.
I spent like well, 18 days total last year on
Wow.
sourdough. Yeah,
Wow.
yeah, a lot
Yeah,
of fun.
I wonder if I wonder what sort of summer we're gonna have in terms of fires this year.
So I just got back. I was in Spokane all week last week, learning how, who, what, when, where, why, and all of that. And it looks to me like it says, "Yep, could be rainy, could be maybe not." What the predictions are, the concern we have is the fact that the snowpack in the Olympics is down by 40%. So that's a little bit of a concern. That could be a little earlier season than normal. Our
Mhm.
normal season is August and September, and that's what it looks like is we're going to be in August and September. So, hey,
Wow.
Greg.
Hi, Greg. Hi, Trish. Um,
Hello.
I did notice that the river, as I was driving out 5:30 looked really low.
Yeah.
Yeah. Okay, gonna give it a couple more minutes. Thank you all for following the breadcrumb trail of links that eventually got you into this room. Thanks to Chief McKern for discovering that the first one was not a good one. That invite. I'm expecting that today we will have both Jeremy, who runs the Brennan Center, Community Center, and Richard Fitzgerald from the Quill Scene. Mostly because I'm looking at doing a community conversation in both of those places. So I prepped them with the fact that we hope to nail down some dates today at this one.
And
Go ahead. Greg. Greg.
He's frozen.
Okay, so it's not me. Because it could very well be me, considering where we all are. Hi, Anya.
Hello.
I'm just gonna give it one more minute and see if we get other folks on.
I think Amelia was gonna come. I just talked to her.
Okay, and I think Richard and Jeremy were gonna come.
Oh, great.
You know, one of the things that at our last meeting we talked about with Holly Gum uh, was having her help with the transition around a South County specific yellow card or whatever color card it ends up being. You haven't by chance seen or had any conversation with, I'm wondering if she's on the invite, but I haven't.
I don't know.
Okay.
Haven't heard from her. I
Haven't
know
heard
the yellow
from-
card needs to be updated. We're kind of doing some more stuff. I did figure it out. The hospital was complaining a little bit, but we figured it out. The hospital has different numbers for a lot of places, and there are a lot of the backdoor numbers, and we don't want to publish those. We want
Right.
the actual public number, not the backdoor numbers. So
I do know I think it's tomorrow's Behavioral Health Summit, we're going to put that card up and have everybody give input to it. So hopefully we've got some hospital people at that meeting that will know the right stuff, because you're right. We absolutely want to get the right numbers on that card.
yeah.
Greg, I think you're back. Did you have a question as you kind of
I
dropped?
was just gonna say too that the community conversations are being, there's a new set like the set that Craig Uchida was convening. The Northwood Canal Chamber of Commerce through Andrew Schwartz is doing those as well. So another potential opportunity where there's already an organizational oomph behind a community conversation if you want to tag
Oh,
in.
great. I'll have to reach out to them. This one, I think you all remember or might remember that we're bringing in somebody to do this interesting sort of artwork interview process. So it will be great. I am going to go ahead and get started. Ron, I don't know you, but it's good to meet you. My name is Lori.
Nice to meet you. Nice
I'm-
to meet you, Laurie.
I'm from the Jefferson County Behavioral Health Consortium, and we have been having this table open down here, gosh, for maybe 4 years now, 3 or 4 years. Okay, I'm putting in the chat links to today's meeting packet, links to what happened at the last meeting. So if any of that is of interest, who we are missing right now, who are crucial to this, are the two community center managers, Richard and Jeremy. And I don't want to take up people's time if for whatever reason they're not on. Perhaps what we should do is go around and introduce ourselves, because it's great to have Ron on. He probably knows some of who's here, maybe all of who's here. Chief McKern, let's start with you.
Absolutely. Tim McKern, Coolstein Fire Rescue, South End Harm Reduction. Since the beginning, since we got started, we're excited to announce that we will have our drug take back program on Saturday from 10 to 2 here in the big town of Coolstein.
Oh, wow. Who's going to be anchoring it down? You guys?
That would be the sheriff
Sheriff?
himself, the
Uh-huh.
sheriff, and someone from public health. I know, Anya, you're going to send some supplies, and there's been some talk back and forth. I have a feeling, I think Holly's coming,
Oh, that'd
but
be
it sounded
great.
like to me, so.
Right. Anya, do you happen to know who might be coming from public health? It's not your job to know.
I don't think anybody's coming from public health, but I know that Gabby is going because
Oh.
public health, I think, just hired for the new Holly role.
Okay.
And I happen to be having a trip that weekend and I'll be out of town. So usually I would go and Holly would go. But I think Gabby's going and I'm getting Gabby the naloxone.
Oh, great. Okay, perfect. Trish. Everybody knows Trish.
I'm Trish Bethard, Superintendent of the Brennan School District, and just Ron and I know I can speak for him too. We're busy trying to hang on as the school year comes to a close, and we have so much to do and getting ready for summer projects. So
you are up to your eyeballs.
pretty much, yeah.
Good to have you here. Thanks for being here. Jim Novelli.
Jim Novelli, CEO at Discovery Behavioral Healthcare, and kind of maybe a little premature, but we're in the process of opening and sharing space with public health down in Quilcene. Hopefully we will be down there several days a week, but the start will be 1 day a week. We'll have a therapist. Actually, our therapist is a licensed social worker who lives in Brennan, and we'll be coming up there and starting to work there. So really excited. Other team members may go down there, like our nurse practitioners, to do evaluations, or even some of our substance abuse providers will be down there to do intakes and things. So slowly expanding out. So it's going to be a little slow process, but we hope to by May get this thing rocking and rolling. So
That is such exciting news. It has been such a long time in the needing and in the making. Does anybody have any questions for Jim before I move on about that? Okay. Commissioner Brotherton? Greg? Or maybe he can't hear. Oh, maybe he's frozen again. Anya?
Hi, my name's Anya Callahan. I work for public health and the harm reduction and syringe service program, and I do overdose prevention, education, and outreach. Jim, I'd love to connect with that person. Amelia and I have been down in Quilcene going to the food bank and doing outreach. So when they get going down there, share my contact, or if you wouldn't mind introducing us, just would love to be able to just support each other and help refer clients and things like that.
she's got quite a bit of a caseload. We have people that
Oh,
come up
good,
from Brennan,
good, awesome.
that come up from Brennan, and this way we will transfer more to down there, so they don't have to make that trip. Makes it easier access. That's one of the big goals. And then obviously as it grows, we'll expand, and yeah, so we're
I'm
hopefully
excited.
meeting with everybody. We went down and looked at the space and all, and I think we got it all worked out. So yeah, I'm excited.
What is the space like? Is it an office? Is there a reception area?
So it's got a walk-in area that's like reception. It has two offices. One is an exam room, one is a regular office. Then it's got a little area in the corner that has a little wall that has toys behind it so kids can play. So it actually works out because our WISE program may be able to do some intakes and things down there and do some family team meetings. So it just depends how many days we can utilize it. Right now, public health uses it 1 day a week on Wednesdays, and we're hoping that we can use it Monday, Tuesday, and Thursdays and Fridays. And we can slowly gravitate that way and put more services down there. So even run some groups. So
Could you just give a little tiny quick overview of the WISE program? Because
WISE Pro is a rapid intensive services. These are for children that are really very, I just use the word very sick, or have some very crucial mental health needs. The team is very intensive. It gets the parents or at least a guardian or somebody involved with this as they work with them. There's two peer counselors that work, an adult peer and a youth peer, that help with the process. We have a coordinator runs the program and one therapist. And we can only have as many, up to 13 as a full team. These are very intensive cases, so we're almost full again. Actually got quite a few, and I don't want to say too much, but I think we're looking at expanding and having a second team. Because the demand is there. So we may be opening up a second team shortly. We talked to the MCOs and they said we can do it whenever we're ready, but whenever ready has to do with making sure we have enough team members. So
right.
Yeah, but that's my goal, is to have a second team eventually, and it's still not enough really sometimes, but
I hear you. Any questions for Jim around WISE, the WISE program? Okay. Anya, were you done? Anya, did you? Yeah. Okay. All right. Holly, I'm so glad you could make it. We weren't sure if you'd be here or not. Happy you are.
Yeah. I think my computer crashed a moment ago. Apologies for dropping off.
Oh, no worries. We thought you might be off to being Port Townsend Coalition person, and
well, that is true, but I'll be here through the beginning as interim coordinator through the beginning of June.
oh, okay. I had the beginning of March. We love it's beginning of June.
Then I'll be covering both coalitions until the new person. I understand an offer was made, and I believe the beginning of June is when they said that they could begin.
Okay.
So for now, I'm here, and probably next month as well. But I'm sorry to drop off the group, but I will make sure to introduce the new individual once they officially begin their duties.
Great, thank you. Thanks so much for managing everything that you're managing right now, just in this window.
I'm sure that the same could be said for every person at this table. There's a lot of work going on.
Denise.
Hi, Lori.
Good. Hi, Denise. How are you?
I'm fantastic.
Do you want to, we've got a group of folks on here. You want to just introduce yourself and any updates or thoughts that you'd like to share as we're getting this meeting underway?
Yes, I'm mostly observing. I love being part of the meeting. I appreciate you inviting me. I am a mother of 2 graduates, and I became involved in this group when I met Anya and Holly and some other folks at the community center in Quilcene, because my primary concern was the opioid crisis and the impact that it has on our local community in Quilcene.
Mm-hmm.
I'm extremely involved in local organizations. For 17 years, I volunteered at all the clubs in town almost. And I had a lot of experience as a mom at the school with sports and, just being a parent that has peers that are parents and all the things that we went through. And Lori, since I talked to you last, I actually was accepted into Peninsula College Behavioral Health Program. So I'm working on my BAS right now.
Congratulations. That's great.
Thank you. And so I worked in mental health for 15 years in Seattle at Harborview and different psychiatric facilities, and have experience working with youth also through the tribes. And so I'm hoping I can contribute to Olympic Peninsula and Clallam County, Jefferson, Kitsap County, with my knowledge base once I graduate. But for now, I'm participating as a volunteer in the community and supporting the work that you're all doing. And I really appreciate everything that all of the fire chiefs and school superintendents, workers in the healthcare, counseling, behavioral health, with children, all the work that you do is very, very important for the future. We are really laying the groundwork for a new era in combating the opioid crisis. And, and Greg, all the politicians, all the local government folks that are helping us to be able to deal with homeless population and children in crisis, as well as the local opioid addicts, etc. But I was just so concerned when we had, a local girl overdose on fentanyl in Seattle that had moved away. And that's when it hit home for me. It could have, and then it just, it's kind of snowballed. The opioid crisis snowballed all of a sudden, and it was in Quilcene.
Mm-hmm.
And so that's where I'm one of the frontline workers with that. Anything I can do to help you, just let me know. Right now, I'm on my way to the Recovery Cafe in Port Townsend. I like to go have lunch there and hang out. So you guys have a great day, and I'll just be observing.
Okay. Thank you, Denise. And congratulations on being in that program. And thank you so much for the work that you do. Gabby.
Hi, I missed the first part of this. What do you want me to say?
Oh, we're just quickly going around and letting people know who you are, what you're associated with, any updates that you have quickly.
Sure. So my name's Gabby Caudell. I'm the clinical director of Believe in Recovery. In South County, we have the mobile clinic that goes down there 4 days a week. We're in Quilcene at the fire department, and then go down to Brennan at that fire department.
Mm-hmm.
And you want an update? I'll be with Sheriff Knoll at the drug take back event on the 27th. And we figured out
grateful.
that is in fact in Quilcene, not in Brennan.
It's incredible.
And other than that, things are busy. We're just super busy. I know that Quilcene Cares is getting back up and running, so I did talk to Kimberly a bit. So I'm excited to get that back up. Excited she's back in town.
Great.
Yeah.
Thank you so much. And thank you for being here. I know everybody's got a lot of things that they're trying to get done. And then Ron, thank you for being here today.
Well, thank you for having me. Ron Moog, Superintendent, Quilcene School District.
And are there any updates, any awareness of stuff going on there that you'd like to share with this group?
I just truly appreciate the partnerships.
Mm-hmm.
Like Tim and I get together frequently, and Trish is my mentor. So anything that I make mistakes, you can blame it on her. No, I'm kidding. And I just being here, not even a year yet, am just really impressed with what I would call those wraparound services that no matter what's going on with students, whether we can handle it inside our system or having connections and partnerships
Mhm.
with our community really helps and provides an advantage for those students who need maybe more than what we can provide in any given day. So just really appreciative of that. It's awesome that we do have a clinic inside our walls. And I know our kids take advantage of it, including our social worker who comes in now 2 days a week.
Mhm.
It's just it truly is, because I've been in systems before where you might not have a social worker enough to cover all the buildings and
Right.
don't have access because the health system isn't nearby. So just it's really wonderful to have.
Well, it's good to know that the resources are well received, and as you discover there's more needed in some way, shape, or form on that landscape, this is the table that we hope to brainstorm how to make that happen for you guys. And Chief Manley, I see that you just joined us. Welcome. We're just having folks introduce themselves and any updates from your area.
Hi, thanks for having me. No major updates here, and I'm Tim Manley, Fire Chief with Brennan Fire.
Good to have you. Okay, quickly, I want to jump into, I think what makes most sense for who we've got on the call right now. The best thing we could do is look at the resource card that is an example of what we have for the whole county, and maybe do some specific brainstorming around what it is that we want to have on that card that's specific to South County. So I'm going to, and I apologize. Can somebody else click the link and share their screen for let me get you the link. Because I am on just one computer, so I'm having a hard time seeing everybody and what we're doing. Hold on one second. Oh, and just to let you know, Greg noted that he is just simply not able to get into the call right now. Okay, if you go to the meeting packet, which is the first link that you'll see in the chat, and scroll down to slide, I think that's slide 7. And there's a link there that says, give us your input now. What that link takes you to is a Padlet, but at the front of the Padlet is a PDF of the yellow card that as it exists. And I'm kind of hoping that we could get some input from folks on what should be on this card that's a resource card specifically for South County.
Do you want me to share that? I've got it pulled up.
Thank you so much. I should also say here that Public Health was handling this yellow card, and the consortium is going to take that over. And so that's one of the reasons why I'd really like to get this going, so I could print them both at the same time in an updated version. As folks look at what we have on the major yellow card, is it simplest maybe to cross off what doesn't belong for South County or what you don't need to have there? Chief McKern, I might be leaning on you a bit for this. I see him moving.
I think it may be a little premature since our behavioral summit is tomorrow. They may be pulling some things out. The Quilcene Food Bank number may be different now. I know they have had a pretty upset stuff in both food banks, and I don't know the answer. I know it's the Lions Club president is also now the president of the food bank, so I don't know any more than that.
Okay. So we may get content at tomorrow's meeting that would apply to this, and then I can circle back to this group?
It might, just like I see the Just Soup, which is St. Paul's Episcopal, that may not be pertinent to the south end.
Sure.
Same thing with Little Free Pantry.
Mhm.
So some of those might not be, and the Ole Cap food truck, I don't think that comes out here. Oh, it says Mill Road. Oh, that was, okay, so that's probably one that's, I think we have the Quilcene in the Tri area. Some of those food bank ones may have to be updated.
Updated. Okay. From the school's perspective, are there resources that you would like to have listed on this card that's specific to South County? Thank you, Anya, for the never use alone.
I'm kind of scanning right now.
Thank you, Trish.
How about do you have the Quilcene Bible Church there? They have a clothing, like a clothes closet. I'm looking to see if that's on there.
I bet it's not, and let's get that onto this card.
I know they do a nice job with that. They have a clothing closet.
Okay.
Trish, I wonder if we should put Dana, the wards and the Assembly of God, they're huge down at this end. We use them a lot when we have to get people from point A to point B and there's no vehicles available. Dan and Dana Ward are the pastors of that church. That's another one that's pretty
Yeah,
big.
I know them. I just am not, you would know there's the services. I just drive past the Quilcene Bible Church when I go to Quilcene and I see that sign that they have the clothes closet. So, but yeah, I think our churches do have some support systems that'd be kind of good to mention.
Okay, so
Go
ahead.
How about the AA meetings that they have at the Brennan Community Center? Are those on there? I'm looking for them.
I bet they're not at Brennan Community Center.
Yeah, they have, I'm calling it AA. Maybe it's got a broader scope than that, but they have well-attended weekly meetings there.
Excellent. Okay.
So I mean, Jeremy Simmons will probably be able to tell you when they meet and how to
Yeah. AA has their own, and so does NA have their own like list of meetings. And if you call that hotline, they'll be able to tell you when and where those meetings are.
Okay. Hold on, I'm looking. Is the hotline in the chat? Hotline is on
To
the.
me, it'd just be good if that was my challenge to be able to look and say, oh, I can go to Brennan, or I mean, they have it right here,
Excellent. Yeah, and we do want to have that information easily available.
Guys, I have to drop off and I have a conflicting meeting. Thank you for including me.
Okay, thank you, Trish. All right, we will circle back. I am not going to try to talk about the community conversations at this time, except to say that they are happening. It's going to be the week of June 10th through the 14th. We have somebody who's coming in to facilitate these conversations sort of throughout Jefferson County. And our goal is to have it one in Quilcene at the community center, one in Brennan at the community center, and to get as many community leaders as we can to have this conversation. It's really low stakes. And the goal is that if we have had leadership participate in the conversation, it might be easier than to go back through at a later time and get additional folks to come in after we've sort of shown that it's an okay thing to do. I'll be sending out, as I can get with Jeremy and Richard and get a date solidified, we'll be sending out posters and social media stuff that can be put up. And then on the Friday of that week, so that's the 14th of June, we'll be having a Train the Trainers session so that folks who are interested can learn how to facilitate the conversation that they've either been a part of down in South County or somewhere else in Jefferson County. And they'll be able to help us continue those conversations without us flying somebody in to facilitate them. So we'd like to raise the profile of that event, but I think without Richard and Jeremy here, we're not going to get very far in that, and I don't want to waste people's time. Are there any other questions, ideas, thoughts that you want to leave us with before I let you all go? Jim?
You may have heard of this, some of you, I don't know, but there's on a podcast from KUOW and the Seattle Times. It's called Lost Patients.
Okay.
And it traces and tracks people with mental illness, starting from the development of the state hospitals and
Mhm.
how mental health has struggled services and SUD services throughout the state's history. It follows different patients
Oh,
at times. They're
uh-huh.
only half-hour long, these episodes. Today was the final episode, 6 episodes. Really easy to listen to while you're driving or something like that.
Uh-huh.
Put it on your Bluetooth. It's really very informative and very educational to really give a better understanding of the struggle of accessing services and how difficult it has been over the years and some
Mhm.
of the barriers and some of the things. So it really does a lot of historical perspective of mental health and outreach in the community and homelessness too. So I think it's really worth and very educational to listen to. I think it'll really enlighten people. So
Well, I will find a link to that and
yeah,
put it in the notes and get it out there.
yeah,
Thank you so much for bringing it up because I have
yeah,
not listened to that.
yeah. So
Thank you. Okay, any other thoughts before I let you go? Thank you so much for your time today. I plan on being down in Quilcene next week, maybe Tim. Ron, I'd love to meet you in person, but I know you're a very busy man, so I'll reach out and see if you have any time. All right, go forth. We'll talk to you soon. Have a great afternoon. Bye-bye.